The recently signed executive order could reduce prescription drug prices by 59% to 90%. A shocking number. If you're using Medicare, Medicaid, or spending hundreds of dollars every month on medications, this could be a true turning point for you. But what makes everything more concerning is that this policy is facing a series of controversies. From opposition by the pharmaceutical industry to skepticism within Congress itself. So, what's really happening? Will it affect your benefits? And more importantly, in this context of uncertainty, what do you need to do to proactively protect yourself? Let's analyze this together right now. Don't forget to subscribe, hit like, and share this video so you don't miss truly essential information. On May 12th, President Donald Trump signed an executive order requiring pharmaceutical companies to adjust prescription drug prices within 30 days. If no progress is made, the Department of Health and Human Services, under the leadership of Robert F. Kennedy Jr., will be given authority to develop a new pricing mechanism. This price will be based on the standards of countries that pay the lowest amounts for the same medications. This is a noteworthy move, not only because of its timing, but also due to the depth of government intervention in the private pharmaceutical industry. President Trump asserts that, if fully implemented, this policy could help Americans reduce prescription drug costs by 59 to 90%. For millions of elderly, disabled individuals, or those dependent on Medicare and Medicaid, this number opens up tremendous hope that essential medications, which previously forced them to choose between treatment and living expenses, come more accessible in the near future. However, this executive order immediately sparked strong reactions from pharmaceutical companies and healthcare policy experts. The Pharmaceutical Research and Manufacturers of America (PHRMA) called it a bad deal for American patients, warning that adopting drug prices from foreign markets could weaken domestic research and investment capacity, while making America more dependent on international supply chains, especially from China. They argue that, in the long run, this would not only affect the pharmaceutical industry but also directly impact access to new treatments, particularly the most advanced drugs that require years of investment and testing. Besides opposition from the industry, this executive order has also sparked debate in political circles. Some Republican leaders appear cautious about the approach of forcefully setting prices through executive order, rather than through the normal legislative process. This is not the first time a most favored nation drug pricing policy has been proposed. During his first term, President Trump signed a similar executive order, but it was blocked by federal courts before it could be implemented. Now, as this policy is restarted, many wonder whether it will go all the way this time, or if it will again encounter legal barriers and political lobbying as before. For citizens, especially those living on medical assistance or with high monthly medication costs, this is a moment where hope and concern go hand in hand. On one hand, they look forward to a change that could help reduce their financial burden. On the other hand, they can't help but question, will drug prices actually decrease as promised? Or will everything stop at an attention-grabbing executive order that is difficult to implement in practice? So, will drug prices actually decrease in the next 30 days? This is a top concern, especially for those who must use prescription drugs long-term for chronic conditions such as diabetes, hypertension, heart disease, or high cholesterol. For them, each pill is not just treatment, but a recurring monthly expense that can consume a large portion of their living budget. When they hear about reductions of 59 to 90%, many feel hopeful, but that hope also comes with caution. Because in reality, not every executive order has an immediate impact. Currently, the executive order is still in the warning and negotiation phase. Pharmaceutical companies have 30 days to negotiate, and the government has not yet published a specific list of which drugs will be subject to price reductions, or whether programs like Medicare Part D will automatically update to new price levels. This leaves many people wondering, will my medication be on the adjusted list? If so, when will it start? While waiting for official updates from the government, there is a proactive step that citizens can take right away: check their medication prices. Those using Medicare can access Medicare.gov and use the drug price comparison tool to see if there have been any changes in recently updated price lists. For those buying medications at local pharmacies, a phone call or direct question to the pharmacist in the coming weeks could give you the most practical answer about whether your drug prices are changing. Being proactive about checking doesn't just help you get accurate information, but also avoids dependence on rumors or uncertain expectations. In a policy that's still in the negotiation process like this one, knowing exactly what you're paying and closely monitoring changes is a necessary step to not miss out on benefits, but also not to have excessive expectations and then be disappointed. Will Medicare and Medicaid users benefit directly and earliest from the Prescription Drug Price Reduction Executive Order? One of the biggest expectations from the executive order just signed by President Trump is the potential to bring direct benefits to those living on the public health insurance system, especially Medicare and Medicaid. These are two programs that cover most prescription drug costs for tens of millions of elderly, disabled, and low-income people across America. So, will this executive order immediately impact them in terms of operating mechanisms? Medicare and Medicaid are two federally managed programs, but implemented with different rules and scopes. Medicare, especially Part D, which is specifically dedicated to covering prescription drugs, operates through private insurance plans contracted with the government. Meanwhile, Medicaid is federally funded but administered by individual states, each of which may have different coverage levels, drug formularies, and pricing policies. Therefore, any changes from the federal level, such as imposing price caps based on international standards, will need time to enter the system, be renegotiated, and updated in existing contracts. This leads to the reality that, although the executive order has been signed and creates clear political pressure, Medicare or Medicaid users may not feel the change immediately. Drug price reductions don't happen all at once on the same day but will depend on many factors. First is the pace of negotiations between the government and pharmaceutical companies within the 30-day deadline. Second is how insurers, pharmacy chains, and drug distribution facilities will respond to price changes. And finally, the extent to which states can and are willing to update their Medicaid systems, which often takes several weeks or even months to adjust. In this context, being proactive in updating information and actively protecting one's rights is very important. Medicare users can proactively check their drug prices through the Plan Finder tool on Medicare.gov, which updates information on drug prices according to specific Part D programs. For Medicaid users, contacting the Medicaid Management Unit in their state of residence is the most practical way to stay informed about policy updates in the coming period. Some states may announce early lists of drugs to be adjusted, while others will need time for budget approval and payment system adjustments. While the policy is still in its early stages and unclear in terms of implementation, it's important for each citizen to understand what type of insurance they have, which drugs are on the coverage list, and to actively update information from official sources. This not only helps them track beneficial changes in a timely manner, but also protects them from the risk of missing benefits when the operating system begins to adjust. Risk of supply and treatment disruption. While many people are placing expectations on the potential for drug price reductions from the new executive order, another quiet concern is beginning to spread if pharmaceutical companies don't agree with this policy. Might people face the risk of drug shortages or treatment disruptions? Immediately after the executive order was announced, the Pharmaceutical Research and Manufacturers of America (PHRMA) reacted strongly. They warned that forcing the U.S. to price drugs at the world's lowest levels would not only lose billions of dollars in research and development investment, but also affect stable supply capabilities. According to manufacturers, when profits are tightened, companies may be forced to scale down production, discontinue distribution of less profitable drugs, or redirect supplies to markets that provide higher benefits. In reality, this has happened before. There have been times when certain cancer, diabetes, or blood clotting disorder treatments have temporarily been in short supply in some areas, simply because production costs exceeded insurance coverage. When policies change faster than supply systems can adapt, the risk of disruption is unavoidable, especially for imported drugs, those requiring special storage, or those exclusively manufactured by a few companies. For people treating chronic diseases, this is not just an economic issue. It's about stability in treatment, about the real risks if they have to switch to alternative medications that their bodies aren't accustomed to, or worse, having to temporarily suspend their regimen while waiting for medications to return to the shelves. Small disruptions in the supply chain can lead to major health consequences, especially for the elderly or patients in special treatment phases. Drug pricing policy is a difficult balance between people's affordability and supply chain sustainability. Price reduction is necessary, but accompanying it are logistics, production, and coordination equations. At a time when everything is still in the negotiation and adjustment phase, being proactive, calm, and grasping accurate information remains the best way to ensure that treatment processes aren't disrupted by changes beyond individual control. Long-term impact, political or substantial. Although the recently announced executive order has created a significant effect in public opinion, many still maintain a cautious attitude. The excitement after the promise to cut drug prices by up to 90% is understandable, but accompanying it is a lingering question: how far will this executive order go, because this is not the first time such a policy has been introduced. In 2020, the Trump administration signed an almost identical executive order, also aimed at linking U.S. drug prices to countries with lower spending levels. However, that order was blocked by federal courts before it could be implemented, on the grounds that the government exceeded its authority by intervening in the pricing mechanism between buyers and sellers in the private sector. People at that time had expectations, then disappointment, and that feeling hasn't completely subsided. Therefore, when the 2025 executive order was issued, many wondered what's different this time. Is the legal mechanism strong enough to overcome previous objections? And if pharmaceutical companies continue to sue in court, will history repeat itself? That question doesn't have an immediate answer. But it's precisely that uncertainty that makes everything more worth watching. If what's happening today could affect the wallets, health, and medication access of millions of people in the coming months, can we just stand by and wait, or do we need to be more proactive, to identify early what changes are real and what promises exist only on paper? If you're using Medicare, Medicaid, or paying for prescription drugs monthly, this is an important time to be proactive. Check your prescriptions, monitor prices on official platforms like Medicare.gov, and, if necessary, ask your pharmacist or insurance agent directly if any changes are about to occur. Getting information early can help you save costs, adjust treatment plans, or avoid unwanted disruptions in the future. Don't wait until everything changes to start learning. Policies will undergo many adjustments, and I'll continue to update all important developments so you aren't left behind. If you're having difficulties with medication costs or have questions about your health insurance benefits, Please share in the comments section below. Each share is a true story and can help others feel less alone when facing the same issue. Thank you for watching to the end of the video. See you in the next video.